An end to the international Zika emergency, but by no means an end to the crisis. The World Health Organization says the mosquito-borne virus is still a threat and that it continued to spread.
We are not downgrading the importance of Zika. In fact, by placing this as a longer-term program of work, we're sending the message that Zika is here to stay and WHO's response is here to stay in a very robust manner.
Zika was declared an international emergency in February. By then, the virus had spread to over 50 countries. Declaring an end to the international emergency in less than a year is impressive, especially considering how long the international community took to effectively respond to West Africa's Ebola crisis. Zika has mostly affected South America, but African countries like Cape Verde have also been affected. 7,000 suspected cases were reported there. The World Health Organization says Africa is especially vulnerable. Countries like Kenya, Senegal, Uganda and Mali are all at risk, and the legacy of the virus endures.
We're dealing with long-term issues here. We're dealing with management of neurological complications in children and in adults. We're dealing with family planning issues. We're dealing with health system issues. We're dealing with maternal reproductive health issues. And we're dealing with a long and comprehensive research and development agenda that needs to be multi-year and has been published by WHO just last month.
Zika can cause birth defects and neurological disorders. The WHO says 2 vaccines are in the clinical trial phase already to help halt the virus more permanently. Susan Mongeli, CCTV.